So for those of you who are joining us today and may not, maybe this is your first time, Care for Nurses is a community created to provide nurses with support, advice, and just a safe place to talk about ongoing challenges or issues in nursing or with other nurses going through the same things that you may be. So we are a community that's just wrapping our arms around each other and really having some excellent conversations. And so we're very pleased and excited to have Eric Small here with us today. He is a trauma and outreach and injury prevention with the WVU Medical Center. So we're very glad to have him. He is going to talk about nursing from a larger perspective today. Is nursing broken and what can you do? You know, this topic lends itself to a very big conversation, I can imagine, Eric.
Yeah.
And so
Yeah.
today we're really wanting to focus on we have 5 bullet points, and today we're probably going to get to the first two. The first one, we're going to really talk about a brief history with the role of nurses that have played in social issues over the years. And then kind of talk about some of those terms that you may hear in this process and identify some key challenges. And then we're looking forward to having Eric back to really dive into some really engaging conversations. So, as you're hearing about this introduction and this space of the history and the terms, jot down some notes, put it in the comments to us, let us know, because we're really looking forward to making this an ongoing, engaging conversation, because I do think it lends itself to as much time as we can give it. So thanks for being here, Eric. I
Yeah.
appreciate it.
Yeah. Thank you so much for having me. I'm really passionate about some of these challenges and issues that we face in the profession of nursing. And so any avenue that we can take for, nursing voices to be heard, I think is critical. And that's really what I kind of hope to promote as we talk through some of these. So you highlighted a little bit for me, got me started, which I really appreciate. Sort of talking a little bit about the history and what I mean. So when we talk about nursing in social issues, we're talking about identifying nurses' impact on social justice, which I know makes some folks cringe, right? But by social justice, I'm really talking about health equity. So the access to healthcare, and I think it's really telling to look at some of that history. So bear with me while we talk about that for just a couple of minutes, and I promise I won't go too long. So we can't talk about nursing, or at least not nursing in its current sort of role and current capacity, without talking about Florence Nightingale. Right, we got to go back to Flo. So Florence Nightingale, we all know a little bit of the history, right? The Crimean War was a big sort of defining moment for developing nursing career. A huge focus initially on what does that environment of care look like? What does it look like to provide care for the folks who are injured, ailing, sick, in a healthy environment? Light, air, those are the kind of things that really started our work of nursing. And then when she came back to England and was practicing in England, it was primarily, home visits, caring for folks in their homes. And that's what nursing was: homes and hospitals, which were sort of a growing thing in that time as urban centers grew, the turn of the last century. And so that's where nursing took place. Was in homes and hospitals. And the folks who could afford to have nurses come to their home, and the folks who are in these hospitals, is a limited pool of people. And so it wasn't too long. It was only about 40, 50 years-ish as nursing starts to really become a thing. That we start to see people going, okay, how do we reach more people? And so that's what we talk about, primarily Lillian Wald, and obviously everybody, there's the great man of history thing. I don't know is always the best way to talk about these things, but sometimes it's useful. So Lillian Wald really starts looking at nursing in the communities, meeting people where they are. So outside of institutions, outside of the homes of the wealthy only, really, where can we go to engage with folks who need our care? Okay, so it's this expansion of what it means to provide nursing care. So that was 1890s when that really got started, and she put together with that program, with that growth, what we sort of now understand to be the social determinants of health. And anybody who's been in nursing school in the last decade definitely knows that, and probably folks who've been in nursing for a lot longer than that. Um, and so kind of the early things of what public health nursing was going to be grew out of that. But then there's a contraction. So there's an expansion and contraction, and there's this pattern that we see when we look at this, and that gets lost a little bit
Mm.
as licensure gets so formalized. So we formalize licensure, and now it's nurses have to work under a physician, and it's physician, nurse. There's this hierarchy that comes with that, and so little bit of a contraction back to those institutions. It doesn't mean that those efforts aren't ongoing, but the potential maybe is a little lost. So that was happening 20s and 30s primarily. I'm very ballpark numbers here, bear with me. So another 40 to 60 years or 40, 50 years later, we need to expand again. We see folks, especially in rural communities now, where they don't have access to a physician's care. The health facilities aren't there. And that is one of the things that really sparks this growth into nurse practitioners, right? Practicing independently of physicians or semi-independently, depending on the state, of physicians to be able to provide care in a lot of places. And so expansion again, we're going where the need is, where the inequities are, to give care for the folks who need it. And so wonderful, wonderful programs. Pay structures, right? Again, some hierarchies and things come in, and now contraction again, because the way we pay folks is through these systems set up that I are way too nuanced to really get into. But now you have to perform certain duties or be in certain institutions or certain structures in order to receive payment for the work you're doing as a nurse. And so expansion, contraction, not as much contraction, right? Overall, we're moving in the right direction, but contraction again. And if your clocks are like mine, you can see that we're maybe due again for another set of expansions. But that's my opinion. So a lot of that comes, and that perspective really comes from an article by Nancy Rudner, who's an advanced practice RN, who wrote this fantastic article that is called "Nursing is a Health Advocacy and Social Justice Movement," and that's where I think a lot of my passion for this expansion, this nursing voice, comes from. The reason we have to advocate for ourselves as nurses, the reason we have to engage in these bigger conversations, is because that's how we can expand our ability to give care or sustain our ability to give care, right? The sustainability of direct care nursing especially is a little bit in crisis right now. And so what does it look like to keep that going? How do we advocate for ourselves in those roles? So I don't want to go too long just just on the history, but that's sort of in a nutshell some of what has inspired me to really start to take on some of these topics and look at some of these things.
Well, and I think for me, hearing, I like how you summarized it, and because we all love patterns, right? We can relate to patterns. When you say there's a pattern, a historical pattern of an expansion and then a contraction, and I'm kind of paraphrasing to see if I
Yeah.
understand. You're saying that over time there's been expansion, but then there's been a larger contraction, but that contraction is decreasing over time,
Mhm.
although we're still seeing it, correct?
Yeah, we're by no means is nursing at square one. There's a huge,
Right.
huge growth in what it means to practice nursing, what it means to be a nurse and nursing autonomy over time.
Sure.
So I do not mean to in any way diminish the
No,
gains
sure.
that have happened. But also recognizing that there is this pushback. There's always going to be the sort of the hierarchical, the structures of power pushback whenever that expansion tries to happen. And so it's important to recognize that, I think. But I appreciate that clarification because that
Yeah.
is a good point that I want to make.
Well, and kind of back to your point too, I had another question. When you said that a one of the bigger movements was when the licensure became
Mhm.
more formalized and structured. Could you expand on that just a little bit by what you mean?
Yeah. So I'm not against licensure and
Sure.
sort of the regulation involved in that. That's
Mhm.
not necessarily the stance that I take. But in that moment, what was a little bit more of the Wild West, the Wild West was ending or at that same time, literally, the Wild West was ending around that same time. Um, uh, it's important to have some structures in place. It's important to have some patterns, some supports, and all of that stuff. But the way that that got enacted and the way that that got really codified in so many ways really limited the scope of practice for nurses in those moments from what it maybe could have grown to be. And it took a long time for us to begin to really push back against that again and grow out of that. So when I'm talking about that, it's not against, hey, we should all just be able to do what we want. No, no, no. And I
Sure.
don't think that's what you were saying, of course.
No. No.
But um, uh, but yes, so those structures are really important. Those structures are critical for the safety of the public in a lot of ways. That's how I see that, at least.
Sure.
But the limits on that also hindered this ability to really give care where it may have been needed and practice sort of at that top of what we could with our knowledge.
So prior to that period, nurses had a little bit more flexibility and responsibility.
Maybe
Right.
it's unclear. The nurses who are really motivated to do that, Lillian Wald
Mhm.
is the example that Nancy Rudner uses. But nurses who are motivated to get out there and do that could. Those
Yeah.
limits weren't necessarily in place, so the vast majority of nursing was already happening in the structures that limit it. But
Okay.
now it's codified. Now it's formalized. That's where we're going to be for the
Perfect.
next 50, 60 years.
Yeah. No, makes sense. No, appreciate
Sure.
the clarification. Thank you.
Yeah, and I thank you for the questions. Um, Go ahead.
I was just gonna say, do we wanna talk about some key words or phrases?
Yeah, so I think it's really important. So I obviously the big thrust of this is to talk about, hey, where can we advocate for ourselves and our profession in nursing? Um, and so I think there's a couple of important terms that we need to sort of understand. So the first of those is shared governance, and for our nurses on the call, I know some folks kind of cringe or roll their eyes again at shared governance. It's this push that we've had over the last several decades, really to take a seat at the table,
Mhm,
which is exactly what I'm talking about. It is this idea that we are going to claim our space in those decision-making structures, and say, no, 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 we need to be here. We are going to share the governance of healthcare is sort of my phrasing of it, and that there's nuance and everything. So grain of salt to some extent. But it's really claiming our space in those processes. But for those folks who have participated in shared governance, the efficacy of that is mixed. And it really depends on the attitudes of the environment that you're in, of the institutions that you're a part of the folks that you're collaborating with. And so there are places where shared governance has just absolutely been phenomenal. Nurses have been able to take ownership in their care, in their practice, and really be a part of what it means to provide care in whatever environment they're in. That was the goal, and is the goal of shared governance. But there's a lot of folks, a lot of places where you got a seat at the table to sit and be quiet.
mm,
And that's an oversimplification, although I see a few nods in the audience there. And so that's been difficult to witness and be a part of. Really not sort of having the autonomy that was meant to provide nurses in their care. Like, hey, you get to be here, but you're going to listen, and just yeah, listen along, nod when we tell you to, kind of thing. Most were more collaborative than that, but that's sort of the spectrum, right, of how effective that is. There's an emerging term that's professional governance. So it's very similar, and the goals are very similar. But it's sort of recognizing the limitation of shared governance. It's recognizing the limitation of, okay, we're going to give you a seat at the table. And professional governance says, no, we're our own table. Is sort of my read on that newer phrase, right? We are going to govern our profession of nursing. and all that that entails. We are going to control the profession of nursing, and we are going to invite others to collaborate with us, and we are going to go and collaborate with others. But we're not just being given a seat at the table. We're creating a table.
Okay.
That's the idea behind it, at least as I understand it on the articles and things that I've read, is to really sort of claim that ownership of nursing, of the profession of nursing. And so I think it's important to understand those terms because again, I saw nods with the interpretation of shared governance, right? That becomes a sour spot in some ways for a lot of nurses of this great idea that isn't really having the influence that is needed, and that we feel is needed. And so that's been a critical, I think, aspect to sort of recognize that as a profession and start to say, okay, what's our next step? How do we move forward, recognizing that hasn't been as effective as it could be in a lot of places. So those are kind of the primary terms that I think are important to understand as we talk about these things. If somebody says shared governance, current structures, having a seat at the table, professional governance, we've built our own table, and we'll invite you to collaborate with us, or we're gonna go and collaborate with you. So
I like the imagery you
yeah,
made there, because
yeah,
that makes it very easy to remember for me. So I appreciate that.
yeah.
Hey, Deb, do you want to chime in a little bit?
Please.
You don't unmute
Oh,
yourself.
muted right now,
I
Deb.
was just going to say, it's sort of and I've gone through a few hospitals that implemented shared governance. Some can do it really well when you, especially if you have a strong nurse executive that gets you on the bandwagon. But unfortunately, I've been through a few that were really, it was just a token. It was like, you can come to the table, but you sit at the kids' table and we'll make all the decisions over here. So I like that, our own table, so much better.
Yeah, and I've experienced both in the same environments. In no way am I disparaging the environment that I work in. I've been in rooms where it is exactly what it should be, where we are engaging with each other and collaborating together and building something new to give the best possible care for our patients. And I've also been in rooms where it's okay, you're here, great, check that box. And so both can be true even in the same institution, right? And so it's a recognition, I think, of the limits of that term shared governance to sort of say, okay, what's the next thing? How do we grow from there a little bit?
So do you find yourself, if you find yourself in an institution where, shared governance it's a process, but it's more of a token, like Deb said.
Sure.
So, okay, maybe a few of you rally together and create a professional governance, right? Is it something that you feel still needs to have some sort of permission, if you will, in order to even be well received? I think that's kind of, there's that dynamic and that
Yeah.
fine line, right?
Yeah. Yeah, and that's really one of the big challenges of it, because you're either acting within a structure or you're acting apart from it, right? That's probably an oversimplification, but if you're acting within those structures, you have the power that structure gives you, right? And when you act apart from it, you're either collaborating with or working against or working alongside, right? Like those are sort of the different ways. And so that gets into some of the other things that can come from advocating for our profession. For some folks, that what you're describing of sort of going apart and doing this thing might be something like a collective bargaining unit or a union. Now, that is not what a lot of unions are, but that's what it could look like in some places to do that. That's not necessarily a one-to-one comparison, but that's where that starts to lean. And that's definitely how structures of power would see that, right? Okay, now, okay, we're acting collectively here. That's a little scary. How do we genuinely engage with that and find out what's going wrong and bring those things into the fold? Great organization. Okay, how do we squash that? Is a lot of organizations, right? That's going to be the instinct I think we see with folks, and those are some of the patterns that I've seen as I've researched some of these topics and talked to others who've tried to engage in these circles. Is those are You have the really great way that that happens, and now we're emboldening and invigorating sort of a shared governance or professional governance place, and others that it's okay. This is dangerous to us as the institution. So how do we work around that?
Well, I'd love for you to kind of explore a little bit or explain to us some of the maybe some higher level things that people or the nurses are coming to the table for, right? What are some of the things that might be discussed or advocated for in this environment?
Yeah, that is the entire spectrum of nursing professional practice and care, and that's a difficulty of this too, right? Nurses are by no means a monolith. We could poll every single nurse in the state of West Virginia and have all 40,000 of them give you slightly different answers, right? Or however many there are. I think it's somewhere in that ballpark. That's a lot of people, by the way. So everybody is going to come with a different perspective, and so it is really important to find where the goals are aligned. Even if the methods may not be, where are those goals aligned? So it might be patient safety. Patient safety might be the thing that you are advocating for. It might have nothing to do with the direct practice of nursing or the workplace environment or something like that, although those are very closely related in most cases. It might be a patient safety issue or a patient access issue or health access issue, as we talked about through some of those history things, right? Those might be the things that you're engaging with and combining on. It might be your workplace environment. It might be lateral incivility is one of the polite terms we've used for bullying in workplaces, right? That might be the issue that you're struggling with, you're passionate about, and that you're wanting to see changed or dealt with in a different way than it is currently, right? So it can be the individual experience. It can be the experience of providing care as a nurse. It can be those outcomes. That whole spectrum is what can be taken on by this. And that's why it's so difficult to really start to build on those collaborations because those goals can be very different. And so I think having those open discussions is that first step. What are the things that you would want to see nursing become? What are the challenges that you see nursing facing? And once you start to pull on those threads a little bit and pull those out, then you find ways to kind of move forward.
Okay, thank you.
And yes, Deb, I saw your comment. Ratios is almost always where both those things align.
I mean, I think sometimes when you say patient safety, I mean, a lot of people outside of the nursing world think, oh, that just means, the bed safe, the equipment safe and all that. But really, it's the number of patients you have that you can keep safe within your threshold. So.
Yeah, I was recently taking a look, and apologies for the slight aside, I was recently taking a look at a project that one of my colleagues had done that was looking at CAUTIs in our trauma patient population, right? And she's done an amazing job sort of drawing some correlations with some things that are put in place to help prevent CAUTIs from forming in our institution. But when you draw the line, COVID is of course where the biggest spike, right, in that happening is. And the things that we put in place were all very nurse driven. And I said, this is the cost of nursing attention, right? I literally pointed at this graph and said, that's what that is.
Yeah, right.
And that's such a critical part of this. And that's why I think it is so important to really advocate for that practice, to be able to give that amount of attention to your patients. I think is one of the things we should absolutely be advocating for, whether that's ratios or whether that's some other way to accomplish that. I think those goals can be aligned.
Oh, thank you so much for that. We did have a commenter said, thank you for the history, Eric. I have a question regarding health equity. The NOM report, The Future of Nursing in 2020-2030, says nurses have a critical role to play in achieving the goal of health equity. But to take on the pursuit of the goal, they need robust education, supportive work environments, and autonomy. Can you talk about how this has changed through history and how we might deal with this challenge in today's world? Thank you.
Yeah, I think that is taking a bite of the whole elephant in some ways, right? That really encompasses so much of that. I'm going to read it here as a little bit just to kind of look at some of those individual points. And so, yeah, education is critical. We need to understand what are the modalities of care that we can provide? What is our scope of practice? What are the techniques that are out there? What are the models? Sometimes we groan a little bit at practice models and things like that as well. Guilty. What are the models that serve us as nurses to be able to do that? Right. That's where I think a lot of the education comes in. Educating and practicing at the top of our scope, I think is really critical for that as well. The supportive work environments. That's the crux of it to me. Those are the areas that I've felt are often not as robust as they need to be, right? In terms of the history through time, it's similar to what I was talking about in terms of that scope of practice and that autonomy. We do have more autonomy. We do have a little bit more control. This has been a process of improvement. Despite the challenges that we face, we still are doing a lot of really amazing things now. To get more detailed than that, I would have to do some research and kind of come back to that. I'd have to look a little bit deeper into some of that to really dive into that.
That's awesome. Thank you so much. I appreciate that. And I think we have about 3 minutes left on our time. So I think now would be a very good time to just kind of address those of you who attended today. I know we couldn't get to everything. Like I said, this topic is one that warrants us to take some time and to really dive into it. One of the things that I would love to do, Eric, I know we talked about, we'd love to have you back
Yeah,
in our
I'd be happy
next
to be.
session, which is in roughly 2 weeks-ish, to talk about how to get involved. What are some avenues for you to, whether there's existing avenues for you to join, whether you can create your own table somewhere, kind of how to do that, right? And then the importance of it, right? So I think you all probably understand the importance of it, but to really kind of talk about that as well. So we'd love to have you back. In the meantime, for anybody who's here or who is listening to this after it's been recorded and posted, we'd love to hear your feedback and your comments, questions that you have for Eric, additional information that you may have because you're having similar conversations with your coworkers or your supervisors. We would, or your professional organizations, right? So we'd love for you to send us that, right? We have an email, it's team@carefornurses.com. So I don't know, Mike, if you can pop that in the comments real quick, but we'd love to hear from you so that when we come back online, we'll be able to address some of those as well. And then after our next or our part 2 version, we would love to have Eric join us in a small group setting. And that is going to be a place where you can RSVP. You can come into a forum just like this, but it's going to be open for everybody to have ask questions, say, hey, I'm doing this. What do you think about that? Really just have that one-on-one interaction with Eric. So be looking for that to come available for you to RSVP. So if you are a nurse in West Virginia and you have not already signed up for the Care for Nurses platform, please do that. We will be sharing that information here, there, so that you'll be able to do that. But if you are not a West Virginia nurse, please email us. So we'll put you on the email list and you'll also receive that information so you can join us, in the future with Eric. So we do appreciate so much you taking the time
I want to thank you all, if I may jump in, so much for the opportunity to share some of this and hopefully for some future collaboration, not only with the work that you're doing with Care for Nurses, which I think is so needed and I hope can help build some real resiliency and robustness with our nursing in the state of West Virginia, but also collaboration with whatever we can grow from these conversations, because I think that's the real opportunity with so much of this. So thank you guys so much.
Perfectly said, Eric. Thank you so much. All right. Well, again, thank you all for taking the time to be here today. We know your time is super valuable. So feel free to send us an email and we look forward to seeing you guys in 2 weeks. Thank you so much.
Thank you. Thank you.
Thank you all.